Welcome to the deep dive. We're here to help you make sense of all that information you send our way, articles, notes, studies. The goal is to get you the key insights fast without that feeling of being totally overwhelmed.
Exactly.
Mm.
You want to understand complex stuff quickly, thoroughly? We get it. Information overload is, well, it's real. So we sift through your material, find those crucial takeaways, those aha moments.
And today, we're diving into something really interesting, Sensate Focus. It's a tool used in sex therapy,
Mhm.
and our main source is Sensate Focus in Sex Therapy, the Illustrated Manual.
Yeah, a great resource. It's written for, well, not just therapists, new ones, experienced ones, but
Yeah.
really for anyone interested. It's seen as pretty universally applicable for sexual issues.
Okay, so digging into the book, the foreword mentions its strengths. And what really jumped out at me was the focus on clear communication.
Absolutely.
Getting everyone on the same page for diagnosis and treatment, which feels vital in this area.
It really is. And it's practical, too. The manual gets right into how to handle common problems, resistance that might pop up. Real-world advice. Super helpful.
And it's interesting, it builds on earlier work, right, from Helen Kaplan.
That's right. It takes inspiration from her Illustrated Manual Sex Therapy, which was a landmark book.
Right.
Kaplan really understood how illustrations could clarify things. She wanted to show the practical side, but also, as she put it, the beauty and humanity of sex.
Hmm.
This new manual expands on that. The illustrations are more interpretive, aiming for a broader audience, more diverse concerns, wider applications.
And Sensate Focus itself, it's not new, is it? The authors have been working with it for decades.
Oh yeah, over 3.5 decades.
Yeah.
Practice, presentations, writing about it, a long history there.
Wow.
And yet, despite all that time and expertise, there's still apparently a lot of confusion about what it is, why it's valuable, how you actually do it.
Which is exactly what we want to clear up in this deep dive. We'll look at what Sensate Focus is, fundamentally.
And just as importantly, what it isn't.
Right. Using the author's experience and how they've structured the manual. So let's start with the core principles. What is Sensate Focus, really?
Okay. So at its core, it's a set of structured touching suggestions. But it's way more than just, touching. It's a specific therapeutic tool.
Oh, okay. And the thinking behind it. Why does it work?
The main idea is reconnecting with the sensory roots of sexuality, shifting focus to present sensations during touch. And this is key. Without any expectation of a particular response, no pressure for arousal or orgasm.
That sounds a lot like mindfulness practice.
Exactly. You nailed it. The manual actually says it's almost identical. That same focused attention on the present moment, the here and now.
And they also talk about this idea of inattention. How does not focusing on something help? Seems counterintuitive.
Well, think about other therapies like systematic desensitization for phobias or relaxation training. Your mind can only really focus intensely on one thing at a time, right? So by deliberately focusing on the touch sensations, the texture, the temperature, you actually prevent your mind from dwelling on anxious thoughts.
Like performance anxiety thoughts.
Precisely. So focusing on touch reduces that performance anxiety. It shifts the focus inward, away from worrying about the partner's reaction.
So the aim is to move attention away from those stressful thoughts onto something neutral, reliable, the physical feeling of touch.
Exactly. Like how meditation might use breath or sound. Yoga uses body sensations. Hypnosis or guided imagery use visuals. Sensate Focus uses touch as its anchor point.
The book's introduction really drives home the power of touch itself, saying it's the first sense we experience.
It is. And they argue it often stays the most emotionally significant sense for many people, but its impact is, well, huge. It can actually change our biochemistry, our neurology.
Wow, that fundamental.
The research suggests it affects our feelings, thoughts, behavior, our relationships, social, intimate, even our ability to heal, to thrive, to survive, really.
They mention research with infants, touch being critical.
That's right. Even if basic needs are met, babies who don't get enough touch can really suffer, physically and psychologically. It's a fundamental human need.
And not just babies, right? Also for the elderly.
Correct. Older adults whose other senses might be fading often do better, physically and mentally, if they keep giving and receiving touch. If that connection fades, their well-being can decline.
And the example of Helen Keller.
Yeah, a really powerful case. Without sight or hearing, touch was her primary connection to the world. It shows how vital that sense is.
So it all connects back. Masters and Johnson saw this fundamental power of touch when they developed Sensate Focus.
Exactly. They recognize this deep human need and how it impacts well-being, especially sexual response and intimacy.
Okay, so that's what Sensate Focus is. Now let's tackle those common confusions. The first one is about sex being a natural function. What's the issue there?
Right. The confusion is thinking of it as purely natural. Sexologists like Perelman see it as a mix of psychosocial factors, culture, behavior, and biology.
So it's not just automatic biology.
No. Some critics, like Tiefer, argue that just calling it natural ignores how much psychology, society, culture shape it.
So where do the manual's authors stand on this?
They definitely see biology and medical factors as important, but they really emphasize that psychosocial factors are often underestimated. They play a huge, often primary role. It's a both-hand thing, not either.
That makes sense. Okay, confusion number two.
Yeah.
The idea that you can directly teach or control natural sexual responses.
Yeah, this is a big one. Believing you can just teach someone desire or arousal or make them have an orgasm on command.
The book uses analogies, right? Like telling someone to fall asleep.
Exactly. Or telling someone, be happy. It just doesn't work like that. Same for sexual responses.
So Sensate Focus isn't about forcing those responses.
Not at all. It's about doing activities, this specific kind of non-demanding touch, that increase the likelihood of those responses happening naturally. Creating the right conditions, you could say, but it can't install a response if it's not there or blocked.
Like trying to hold your breath forever, or, the classic trying to give a urine sample under pressure.
Exactly. The harder you try, the harder it gets.
Right.
Which leads to what the authors call the paradox of sexual responsiveness.
Okay, what's that?
Basically, the harder you try to make arousal or orgasm happen, the less likely they are. But if you try to suppress them, they might get stronger. That conscious effort creates anxiety, which gets in the way.
So letting go of trying is key.
It's counterintuitive, but yes, less trying for an outcome makes the outcome more likely.
That's a huge takeaway. Okay, third confusion. The wording used in Sensate Focus instructions.
This is surprisingly critical. Using the wrong words can accidentally create that performance pressure again. Undermines the whole point.
Can you give examples? What words to avoid?
Sure. Things like give pleasure, or try to relax, or enjoy being touched. They sound nice, but they put pressure on the toucher to do something for the partner and on the receiver to feel a certain way.
What about just the word feeling? Seems neutral.
It's tricky. The manual says clarify it. People might think emotion and then feel pressured to feel aroused or close. Be specific about the kind of feeling.
So sensual or sensuality are probably out too early on.
Yeah, too easily linked to sexual and arousal expectations. They strongly recommend using sensation, especially at first.
But even sensation needs defining.
Absolutely. Define it narrowly and clearly. Just temperature, pressure, and texture. Keeps the focus concrete, physical, in the moment.
Wow, the language is so important. Okay, let's move to actually doing it. What's the formula for implementing Sensate Focus?
There are three key sort of attitudinal skill sets, foundational mindset shifts for both partners.
Okay, what are they?
First, and maybe most important, touching for self versus touching for the partner.
Touching for self.
Yes. The toucher focuses on their own experience, their interest, curiosity, the sensations they feel, temperature, pressure, texture on their partner's skin, not on trying to get a reaction from the partner.
So the toucher needs to be a bit self-focused, therapeutically speaking.
Exactly. It takes the pressure off. No need to perform pleasure for the partner. Big reduction in anxiety.
Makes sense. What's the second skill?
Second is describing sensations versus describing judgments and emotions. When touching, and especially when talking about it later, focus on objective descriptions. Was it cool, warm, firm, light, smooth, rough?
So no, that felt good, or I felt bored.
Exactly. Avoid evaluations or emotional commentary like, I felt so close or I was frustrated. Keep it purely descriptive. Physical sensations only.
Got it. And the third skill?
Third is identifying and managing distractions. Clients learn to notice anything that isn't temperature, texture, or pressure as a distraction. Worries about work, relationship anxieties, even positive thoughts initially.
Even positive thoughts, like this is nice.
In the early stages, yes. Even positive thoughts can pull attention away from the main goal. Just focusing on the tactile sensations. It's about training the mind to stay present with the touch.
And when a distraction happens?
Gently redirect attention back to the sensations. Temperature, texture, pressure. The goal isn't zero distractions. That's impossible. It's about noticing the mind wandering and bringing it back.
Okay, those three shifts sound crucial. Now, you mentioned it's often done in stages. Sensate Focus 1, what does that involve?
Right. SF1 sets the foundation. It starts with specific limitations on touch, deliberately designed to lower anxiety and shift focus purely to sensation.
What kind of limitations?
Things like no kissing, no full-body hugging at first. The toucher usually just uses fingers, palms, back of the hands. More intimate touches off the table initially.
What if arousal happens anyway?
It's just noticed, acknowledged as a natural response, but no action is taken towards a sexual goal. The focus stays on the agreed-upon non-genital touch.
Sounds like it's really designed to take the pressure off.
Totally. A common reaction is relief. People feel they can finally touch and be touched without that weight of expectation, that pressure to perform sexually.
And there's an individual part too? Self-discovery?
Yes. Often people practice touching their own bodies first. Non-genital areas, avoiding breast, chest, and genitals initially, or any sensitive spots, helps build comfort with one's own body and sensations safely.
Then how does it progress with couples? What do those early SF1 sessions look like?
Typically, they start with breast, chest, and genitals off limits. Touching might happen with both lying down, back, or front, just exploring non-genital areas. The manual has illustrations showing different positions. As they get comfortable focusing on sensation, they might gradually include breast, chest, and genitals, maybe in different positions like one sitting, one lying, or both sitting.
You also mentioned moving the toucher's hand or handwriting. What's that about?
Handwriting, especially positive handwriting, is a nonverbal communication tool. The person being touched gently guides the partner's hand, maybe towards an area they like, or indicating different pressure. Positive handwriting guides towards pleasant sensations.
Okay. With all this focus on sensation, is any talking allowed during SF1?
Good question. There are two main exceptions to the no talking rule. First, practical stuff, saying switch to change roles or stop if they need a break or time's up.
Right. And the second?
That's for managing anxiety. They agree on a code word beforehand. If anxiety spikes, either person says the word. They then immediately change the touch location or type, but keep touching. The word should be neutral or positive, like change or next, not something alarming.
So some clear communication is still built in. What happens after an SF1 session?
Processing is key. Right after, both people reflect, maybe write down sensations they noticed and any distractions.
Why write it down?
It reinforces that descriptive, non-judgmental focus, helps them stick to reporting sensations, not evaluating the experience or the partner, and it gives the therapist good info.
You mentioned earlier that for some issues like trauma or penetration disorder, starting with individual self-sensate focus is better.
Yes, definitely. For those conditions, or maybe premature delayed ejaculation too, starting solo gives the person a safe space to build comfort with their body and sensations before adding the complexity of partnered touch.
Okay, and if arousal does happen during a couple's SF1 session, how's that handled?
Like we said, just notice it. No pressure to act.
Yeah.
The toucher keeps focusing on their own exploration of sensations, and the person touched avoids redirecting the hand towards a sexual goal. Still all about non-genital sensation focus.
The manual mentions positions like partner astride without insertion, then with insertion, later in SF1. How do those fit?
Those are more advanced steps within SF1,
Yeah.
introduced only after the basics are solid. Partner astride without insertion allows exploring genital closeness without pressure for intercourse, still focusing on touch sensations.
Right.
When moving to with insertion, the receiving partner guides it slowly, mindfully, focusing on tactile sensations. Full erection isn't necessary. If arousal is lost, it's seen as a learning chance about performance anxiety, not a failure.
This whole SF1 process, focusing on non-goal touch, feels like a big shift. The manual calls it the paradox of powerful presence.
Yeah, that phrase really captures it. It's about shifting away from trying to control sexual responses and instead honoring them as natural functions. You do this by focusing attention away from anxiety and onto present moment sensation for your own interest.
So by letting go of controlling the outcome, you create space for it to happen naturally.
Exactly. It reduces pressure and expectations. By focusing on what you can control your attention to sensation, people often find they start experiencing the arousal, pleasure, intimacy they were looking for, paradoxically, without striving for it.
That's a really powerful reframe. Now, after an SF1 session, how does the therapist guide the discussion, the processing?
The processing session is vital. Both partners share their experience, usually taking turns starting each session. Ensures both get heard properly, maybe more than in daily life.
What kind of questions does the therapist ask?
Specific ones, linking back to those 3 skills, like what temperature, pressure, texture did you notice, where? What distractions came up, how did you manage them? Hopefully, by refocusing on touch.
So they're checking if the focus stayed on sensation.
Pretty much. If someone says things like, I didn't feel him get hard, or she seemed to like that, it suggests their focus was still on outcome or the partner, not their own sensations. That's useful feedback for the therapist.
And there was a point about handwriting early on.
Yes, don't overuse it in early SF1. Let the toucher explore and build that self-focused attention habit. If the partner guides too much too soon, the toucher might not develop that skill. Save it for when it's really needed or later stages.
It's amazing how many subtle details make this seemingly simple exercise work. Now, the manual says Sensate Focus has been adapted a lot over the years for different people and issues.
Absolutely. It started mainly with straight, able-bodied couples, but therapists have adapted it creatively for LGBTQ plus folks, gender-variant people, kink communities, non-monogamous relationships.
And for specific sexual dysfunctions, are there particular tweaks?
Yes, definitely. For male HSDD, low desire, history is key. SF can be diagnostic. Scheduling sessions helps. Often need to treat underlying ED or PE too.
What about female sexual interest arousal disorder, FSIAD?
Important to know her motivation. Relationship dynamics often key here, though medical factors matter too. Self-SF and fantasy work might come first. Slowing down, positive handwriting are helpful. It's a newer diagnosis reflecting complexity.
And for erectile disorder, ED?
Need to consider biomedical and psychological factors. During SF, might guide touch away from the penis when erection occurs, back to full body. A stride position doesn't require full erection initially. Visual connection helps. The code word for anxiety is useful here. Helps break the erection, immediate intercourse pressure.
Female orgasmic disorder.
FOD. Key point. Most women need clitoral stimulation, need a full evaluation, meds, medical issues, psychology, partner factors. Self-touch, SF, and education are usually crucial first steps.
Premature ejaculation, PE.
Focus on awareness of arousal levels. Practicing stopping before inevitability, stop-start, squeeze techniques. Partner-directed stopping-starting during SF touch helps build control.
And the opposite, delayed ejaculation, DE.
Primary DE is rare. Assess medical, psychological relationship factors. Might encourage more vigorous stimulation, use a code word for changes. PC muscle exercises, deep breathing might help.
What about pain conditions like dyspareunia or vaginismus?
Client's control is paramount here. Medical exam is essential first. Mindfulness, graduated dilators often used. SF starts with individual touch on non-painful areas. Couple SF might come later, maybe after orgasm via self-touch, to reduce anxiety.
And those diverse populations you mentioned, LGBTQ plus, ELKR, gender variant, kink, non-monogamous clients, any key thoughts?
The main thing is adapting sensitively to their specific needs and dynamics. For gay couples with ED, maybe focus more on visual aspects. Kink clients might use SF to slow down or bridge other practices. Polyamorous folks might use it to deepen intimacy in specific pairings. Trans clients need a collaborative approach about comfortable touch and release.
It's clear it needs careful tailoring. Now, the manual talks about common problems that crop up when starting Sensate Focus. What challenges come up?
Yes, some problems are pretty predictable early on. Important thing is to reframe them. They often show the very issues that brought the couple to therapy. Not failures, but insights.
Like what sort of problems?
One big one is delaying the touching sessions. Maybe one partner is eager, the other drags their feet. Or both find excuses: too busy, too tired, fear of failure.
How do therapists handle that avoidance?
Suggest treating sessions like therapy appointments, make them a priority. Explore the why behind the avoidance. Power dynamics, intimacy fears. Pointing out how the pattern mirrors their relationship issues can motivate them.
Another one is non-compliance, right? Not doing it or doing more than suggested.
Yeah, often stems from fear, confusion, guilt, anxiety, unrealistic expectations. The therapist needs to explore that gently, re-explain the why behind the instructions. Frame failure as information, not judgment. Explaining the rationale really boosts compliance.
And I imagine pushing for intercourse or orgasm too soon is common.
Very. It signals falling back into that goal-oriented pattern SF tries to break. Can show underlying pressure or misunderstanding. Therapist gently redirects, explaining how it hinders progress towards deeper intimacy and less anxiety.
What about release or orgasm if it just happens during SF1?
If it's unintentional, just note it. Don't pursue it further sexually. Keep the focus on the non-genital touch. Later, if both want release after an SF session, the manual suggests the initiator goes first, then the partner chooses how they want release. If they do, keeps it mutual.
Really practical stuff. The manual also touches on adapting SF for people with other psychological or physical issues.
Yes, If significant issues show up in the history, they likely need attention alongside SF.
Like what psychological conditions?
Things like anxiety, depression, mood disorders, even psychosis. SF works best here with appropriate meds and other therapy. Many sex therapists are trained for these broader issues too.
What about difficult or challenging clients?
That takes skill and experience. Good supervision helps. Sometimes paradoxical techniques might be used within the SF framework.
And sexual trauma survivors, that needs a special approach.
Absolutely critical. Trauma-informed care is essential. Empowering the survivor, identifying triggers, often moving between individual trauma work and couple SF carefully. Handwriting, body mapping, maybe EMDR could be part of it.
Clients with autism spectrum disorders.
Need to consider sensory differences. Might use things like compression suits or body maps for clarity on comfortable touch. The structure of SF itself can actually be helpful for some on the spectrum.
And finally, clients with physical challenges or disabilities.
Psychoeducation is vital, challenging beliefs like my sex life is over. Focus might shift to emotional connection, different forms of intimacy, communication. Emphasize that sexual response often continues, explore what is possible and fulfilling.
It's so clear how flexible and sensitive the therapist needs to be. Now, the manual moves to Sensate Focus 2. How is that different from SF1?
SF2 builds directly on that SF1 foundation, the sensory awareness, the reduced anxiety. It expands things into deeper, more complex intimacy.
Expands how? What's the focus in SF2?
It moves towards more intense emotional connection, deeper sexual and erotic intimacy involving vulnerability, trust, surrender. More open communication, verbal and nonverbal, about preferences during touch, and sometimes what the authors call transcendence, a deeper, maybe spiritual connection.
So less purely sensory, more holistic and emotional.
Exactly. Direct talk about desires, preferences, what feels good becomes much more encouraged and part of the interaction in SF2.
Are new activities introduced in SF2?
Often, yes. Couples might explore reading erotic material together, sharing visual images, creating fantasies, using toys or vibrators. It's about exploring mutually engaging activities that deepen erotic connection.
But those SF1 skills are still important.
Absolutely essential. That self-focused sensory absorption from SF1 underpins the deeper intimacy of SF2. And if couples hit roadblocks in SF2, going back to SF1 principles for a bit can help them reconnect and get back on track.
So SF1 is really the bedrock. In their conclusion, the authors seem a bit surprised. SF is still so widely used and effective.
Yeah, they note its effectiveness across different settings, even though some might see it as an older technique. They wonder if it's partly a reaction to the increasing medicalization of sex. Maybe a swing back towards valuing psychosexual approaches like SF.
And they suggest areas for future research.
Yes. Like, how does the way SF is explained affect outcome? How effective are specific modifications? And just more objective research on its overall effectiveness compared to other treatments.
The story they share at the end about the premature baby revived by skin-to-skin contact, it's powerful.
It really is. A reminder of the fundamental life-giving energy in touch. They suggest SF harnesses that same energy for healing sexual response and well-being.
And they bring back Helen Kaplan's idea that beauty and humanity of sex.
And they finish with a Carl Jung quote about sexuality and sensuality being the source of beauty, art, human desire, urging us to see that deeper dimension.
A really profound ending. So just to recap the key takeaways from this deep dive into your manual on Sensate Focus.
Okay. At its heart, it's a structured way to explore touch, focusing on direct physical sensation, minus the pressure for a specific outcome.
Right. It's about shifting attention to the present moment to reduce performance anxiety.
It's clearly not rigid. It's adaptable, can be tailored for all sorts of people, relationships, and sexual concerns.
Exactly. So we hope this deep dive, based right on your source material, gives you a solid understanding of Sensate Focus, the ideas, the practice, the why.
Yeah, definitely. Maybe take some time to think about how these ideas resonate with your own understanding of intimacy, connection, sexuality.
And here's a final thought to chew on. Could intentionally shifting your focus in intimate moments towards just the simple sensations of touch, could that actually unlock deeper connection and pleasure than actively chasing a specific outcome?
It's an interesting question, isn't it? Something to explore.
Definitely. And if you have more questions or other topics in sexual health you want us to dive into, just send the material our way. We're always ready for the next exploration.